The Foreign Secretary, Philip Hammond, and the Armed Forces Minister, Mark Francois, have been meeting British troops battling the Ebola outbreak in Sierra Leone. The visit comes as the World Health Organization reports that deaths from the virus have passed 5,000 across West Africa, with a steep increase in new cases in Sierra Leone. Earlier, Mr. Francois spoke about the visit to my colleague, Josella Waldron, at British Forces Radio.
My impression really is one of immense pride, actually, by seeing what our armed forces personnel have been achieving out here. I visited the National Ebola Response Centre this morning, where our armed forces personnel are working side by side with the Sierra Leoneans to coordinate the response across the country to fight the disease. Then I went on to the Ebola Training Academy, where we've trained over 1,700 Sierra Leonean healthcare workers. And we've got about another 800 going through that training program this week to help them to fight the disease in their own country. And I've just come back from visiting Tutu Field Hospital at Kerrytown, where they're working alongside Save the Children. Save the Children have got a facility for up to 80 beds for civilians. And Tutu Field Hospital are running a specialised facility to provide high-end medical care were any international healthcare workers to become infected. And I've seen our personnel doing that. I met two who literally just come off shift coming out of the hot tent. And it's immensely impressive what our people are doing, frankly.
It's been reported there's been a sharp rise in cases, which is suggesting the situation is getting worse. Could the number of British troops helping out there rise?
Well, the information I have is that while the number of reported cases has increased, and that's partly because people are now more confident to come forward and report when they have the disease, the rate of increase is beginning to slow slightly. So, we're by no means out of the woods yet. I mean, there's still a great deal to do, but clearly our efforts are beginning to have some effect. We've got over 800 military personnel deployed here now, so that's a very considerable commitment. And I just mentioned the Kerrytown facility that's just recently opened. We've got 5 more Ebola treatment centres, which are like 5 mini hospitals, if you like, each of around 100 additional beds. And our Royal Engineers have been overseeing their construction, and they should now open next month. So that will materially increase the bed capacity in Sierra Leone as well. So we're already making a pretty significant contribution, and we've already got 800 people deployed in theatre.
You say it's a considerable commitment, but how will you sustain it and how long for?
Well, in financial terms, the government's committed not far short of £250 million. So in money terms, it's a very considerable commitment. In human terms, it's a really considerable commitment of 800 personnel. And we will rotate people through theatre as we need to in order to maintain the force structure that we have to have. So people's tour lengths here will vary depending on the role that they've got. But for instance, the medics at Kerrytown will do about a 2-month tour because working in that hot tent is very intense work. And we've already got another cohort training at Strensall to come and relieve them when they finish their tour of duty. So we're already thinking ahead about how we can replace people when they return from theatre.